Well, thank you very much for the invitation and for allowing me to speak today. I'm going to move away from hybrid mind, away from legal frameworks, and really more into an applied study where we try to investigate ethical implications that are associated with the use of AI chatbots in the context of mental health support. Since this session is called Neurotechnology for Good, I promise I will highlight as well some of the benefits and advantages of making use of AI chatbots, but I will end on not so much of a positive note, kind of highlighting some of the gaps that are still required for us to research even further and try to improve the implementation of AI chatbots in psychiatry and in mental health support in general. So a few years ago, a Belgian person was convinced to commit suicide. And you might be wondering, how was he convinced? Who convinced him to commit suicide? But the question here is not so much who convinced him, but what convinced him to commit suicide. And in fact, the widow of that particular person blames the chatbot that apparently completely changed and exacerbated the condition of that person. Let's call him Pierre, which at some point in time, he started developing some kind of anxiety in relation to climate change and the climate crisis. And he resorted to Eliza, which was a chatbot. And in the course of 6 weeks, he really went into details and into the in-depth conversation about the climate crisis and about his responsibility and his role in society and in contributing to the climate crisis. And eventually, after looking at the script, Eliza provided them even with tips and tricks on how to commit suicide. But I mean, let's look a bit more from a general point of view and try to see why AI chatbots for mental health. This is an application that has been promised to revolutionize psychiatry, but also mental health support. First of all, we can look at it being really a cost-effective implementation and tool. It provides wide access to a number of individuals that otherwise do not have access to mental health support due to shortage of psychologists and therapists, but also especially those that come, for example, from the Global South, from disadvantaged backgrounds. The ability to converse in an anonymously in a private setting, the scalability of the tool, the ability to be considered as an educational resource where individuals can have some kind of health literacy, mental health literacy, and of course, by incorporating AI algorithms, the ability to provide personalized support. But of course, I mean, ChatGPT, which is one of the AI chatbots that we are most familiar with nowadays, is not the very first chatbot that has been used as a mental health support tool. We can go back all the way to the 1960s with Eliza, with it being the very first chatbot which simulated conversation as with a therapist. And then moving on, we see how chatbots were used also to aid clinicians, not necessarily patients or users, but really to aid clinicians in providing therapy for their clients and patients. Some of them incorporating some cognitive behavioral therapy approaches. And then, of course, we see that with the pandemic, the COVID-19 pandemic, resorting to more teletherapy and digital mental health tools really exponentially increased. And eventually the release of ChatGPT by OpenAI, which is a large language model, really increased the horizons and showed the multitude of opportunities that large language model-based chatbots offer for mental health support and care. So if we want to compare one of the oldest or an old version of AI chatbots with a more advanced large language model based chatbot, we can look a little bit at some of the characteristics that distinguish, for example, Woobot, which is specifically a rules-based decision tree model and does not really incorporate statistics-based large language model like ChatGPT does. Woobot is more goal-oriented, where ChatGPT is more open-ended. It's more of a conversational chatbot. Woobot has been clinically validated, whereas ChatGPT has not been clinically validated for therapy. Woobot has also been designed with the intention to be targeted to a specific population that is seeking mental health, whereas ChatGPT is really accessible to all. And of course, it can be tailored to a specific population. But currently, if we see the way it is being used, it is not necessarily specific to individuals that are seeking mental health support. And I found that interesting because I think it's very important to talk about the technical aspect of ChatGPT or emerging chatbots, because if we don't know about what they can and cannot do, what are the promises that they can offer, but also their limitations, we might exaggerate and we might hype up the technology, even in the context of medicine and psychiatry. And I think the way currently AI, and especially with the release of ChatGPT, a lot of us have really only thought of the potential promises and opportunities that AI chatbots, including ChatGPT, will offer in all sectors and in all levels of our lives, in medicine, education. And I think the more we are starting to identify risks and ethical challenges, we are starting to see that the promises are not necessarily as true or as real as we want them to be. And so if we look throughout, looking at the very first chatbot, Eliza, that was released, and the more we move into more advanced AI chatbots, we see that there are some of the same ethical concerns are there. But of course, the more we are moving into advanced chatbots, including large language models, new concerns arise, new ethical issues arise, both in relation to the patient, but also to other stakeholders. So for example, some of them, of course, relate to privacy and data security, transparency, ensuring that the information that's being provided is well evidence-based, is not just random, the ability for the chatbot to show some kind of empathy or to kind of provide some kind of support that could be simulated as well in a therapeutic setting. The issues related to the possibility of providing misinformation to users, bias and fairness, especially in relation to AI algorithms, accountability, who is accountable if the chatbot provides faulty information, or if in the case of Pierre, for example, that committed suicide, who is accountable in this case, the over-reliance and dependency on these chatbots, the lack of human oversight, and in particular of expert oversight. We also in relation to this suicide case, we question the ability of these chatbots to manipulate or provide some kind of behavioral influence on the users, any type of associated harm, potential improvement or enhancement of autonomy, but also the exacerbating or decreasing the sense of autonomy in users by interacting with a chatbot. And of course, eventually how this will impact our social relationships. I think we always talk about chatbots and how they can improve the condition or the symptoms of a certain individual, but we never put it in context of how this will influence our social relationships. Because we also see that those that do seek, for example, technologies tend to self-isolate and move away from interacting with peers, interacting with human therapists, which in a way also exacerbates their mental health symptoms. So some of the questions that arise by looking at all these different ethical concerns that have already been documented quite extensively in the past decade, and if not more, is these concerns that are arising, for whom are they arising? Which concerns are the most urgent and that we really need to attend to? And are the reported concerns that the literature provides 10 years ago, are they the same today with those advanced AI chatbots? So in order to do that, we sought to investigate a little bit and kind of explore how do different stakeholders, including mental health professionals, patients, and potential users, how do they perceive the benefits of making use of AI chatbots for mental health, their needs in terms of what would be needed for them to ensure a responsible use and a trustworthy use of AI chatbots, but also the concerns and the ethical concerns that are associated with the implementation of these tools. And so just a little bit on how we decided to approach this. We did a mixed method survey. We included several multiple choice questions and also open-ended questions. And we, as I was saying, we involved mental health professionals, patients, and potential users. And we then distributed through the platform Qualtrics, and we did not really limit it to any geographical location. We tried as much as possible to have a widespread understanding of different opinions and perspectives on these different points. And so one thing we wanted to make clear before diving into the different benefits, needs, and concerns is how are these chatbots being used? Is there a willingness to use these chatbots? And what are the applications that these users see as an intended application for these tools? And so if we look at potential users, and what we mean by potential users here is anyone that might have interest in making use of digital mental health tools like AI chatbots. They do not necessarily have any mental health condition, but they are interested in potentially seeking some of these tools. We see that 46% are willing to make use of them. From the patients, 39% are willing to make use of AI chatbots, whereas for mental health professionals, 75% were really positive or willing to make use of these AI chatbots. And when we kind of zoomed in more into what are some intended applications that they see are beneficial for these tools, potential users mentioned making use of them to gain general health information, and more practical uses were most favored. And by practical uses, for example, seeking information on what are the therapists that are available in the region, how could they be informed about certain different therapies that are available in their region. Whereas patients, for example, also favored the use of AI chatbots in order to gain general health information. However, interestingly, unlike potential users, they would also like to make use of it to help them when they are experiencing the stress. And I think this is quite interesting. And I want you to just keep that in mind a little bit, that patients really favored, and this was one of their most intended application of AI chatbots, because we will see that with mental health professionals, for them being I would say, there's a very big proportion of them that really favors the use of chatbots. It was mainly for more practical assistance, such as reducing administrative burden and complementing existing therapy. However, if we look at the intended applications, one of the least favored intended application for AI chatbots was for immediate support for crisis intervention and for crisis situations, which is completely the opposite of what patients saw as an intended application. And I think this is very important because we could already see there that patients might be more willing to seek AI chatbots during crisis than to go to a therapist, and of course, this increases concerns and alarm bells because AI chatbots, as they currently exist, are not well equipped to deal with crisis situations of mental health, of individuals suffering from a mental health condition. And we then moved on to ask about the benefits. And of course, first we wanted to understand whether those that are willing, we just focused on those that were willing to make use of AI chatbots. But of course, from those that were unwilling to make use of AI chatbots, we wanted to also see if ever they would be. So not necessarily their current perception about the use of AI chatbots, but whether they might perceive any benefits in the future in the use of AI chatbots. And already 46% of these 52% did perceive benefits. And so we also included them in trying to identify some of the benefits of AI chatbots. Some of the most perceived benefits related to accessibility, practical assistance, organizational planning, and filling the gap in mental health care. whereas the least perceived benefits were most related to personalized mental health support and guidance, which is also something that has been often discussed in the literature, that AI chatbots is really promising and will be able to provide personalized mental health support, but this does not seem to be something that is particularly perceived as beneficial for those that are willing to make use of AI chatbots. And so here are also some of the other benefits that were also highlighted or that were also mentioned by the different groups. And we see that in general between the groups, there isn't so much of a discrepancy in terms of what are the perceived benefits in making use of AI chatbots. And then we asked the participants to also identify their own potential benefits that we might not have mentioned in the questionnaire. And so one potential user mentioned that people may feel less of a barrier, and they mentioned a chatbot cannot judge you. So this availability of a platform or of a space to anonymously speak without feeling judged was something that they perceived as beneficial. A mental health professional also mentioned that broadening the scope of the professional of treatment options and diagnostic ideas and concepts. So really kind of being a complementary assistant tool to the to aid in kind of the therapeutic process, but more on a professional level. So really providing more professional guidance to the therapists themselves. And then we moved on to the concerns. One of the most perceived concerns were privacy and security, which is also very in accordance with the literature, but also a decrease in human-to-human interaction, which of course is something that, as I was mentioning in the beginning, is a very important thing to take into account, since the more we see people seeking digital mental health tools, we might see that there will be a decrease in human-to-human interaction. And the least perceived concerns were the loss of users' autonomy and a lack of reliability of the technology, which is quite interesting because, and I will mention that towards the end, often when we talk about digital mental health tools, but also digital assistants like wearables, for example, on one hand, they of course can enhance a user's autonomy, but they can also jeopardize that autonomy. And in this case, participants did not necessarily see that autonomy can be jeopardized, but I don't think this is completely true. And here are some of the other concerns that were also mentioned and that we also tried to highlight. I think also one interesting one is the potential for harm and the potential of manipulation of users. And I think what we do see is mental health professionals do not necessarily see that as a threat. And I think looking more at large language models and their ability to really be perceived as human-like, and this power they have over how human-like they can converse with users. This is also something to keep in mind and to question whether we can completely kind of neglect this concern or not. But also, more importantly, I would say the therapeutic misconception seems to also be a bit of a unanimous concern among all of the different groups. Some additional perceived concerns that the participants themselves mentioned were that AI chatbots may worsen their negative behaviors, it may increase their emotional distress, increase social isolation. Interestingly, participants and potential users and patients, and not mental health professionals themselves, mentioned the loss of jobs of mental health professionals. So they themselves identified a concern for mental health professionals, whereas mental health professionals did not see that as a concern for themselves, which is also interesting, in line with how they might be seeing also AI chatbots as a replacement instead of a complementary tool to therapy. Increased disengagement was also mentioned, and a lack of human empathy and understanding. And this was quite mentioned a few times, this kind of concern of having the AI chatbot not quite understand what the individual or the user is actually going through. And so some of also the interesting direct quotes that I would like to share with you that also highlight some different concerns that were mentioned is, for example, one by a potential user saying, I would say that collectively speaking, talking about mental health issues by using an AI chatbot might perpetuate the associated stigma, prejudices of mental health. It is still a taboo to openly talk with people about mental health issues. And I think that AI chatbots might contribute to this development since they stimulate talking privately about one's problems instead of sharing it in the public sphere with other people. And I think this also kind of clashes a little bit with one of the benefits that is associated with AI chatbots, which is the ability to anonymously and privately converse with a chatbot. And then we have the risk that it becomes easy that therapists rely on it too much and the human responsibility is forgotten. So this was a quote by a mental health professional, which also kind of contradicts a little bit another benefit that was perceived by mental health professionals, where AI chatbots could kind of provide additive guidance to the therapeutic process. So since I see that I don't have a lot of time, I'm going to rush through this, unfortunately. But we also wanted to understand the requirements that they believed were important in order for them to comfortably make use of AI chatbots. The most important requirements were ensured privacy and data security and expert oversight. And the least important requirements was improved reliability of the technology, which was also interesting, and the existence of chatbots which have a human-like response. So those were also some more quotes. Some included also the requirement to have more of legal agreements, focusing on what are the boundaries of what an AI chatbot can or cannot provide. A mental health professional mentioned that it should not be seen as a replacement, but in addition to therapy, especially in crisis situations where only therapists should handle these cases. And then chatbot has limited accessibility to prevent dependency. And this accessibility is determined according to the severity of mental health symptoms. And also a mental health professional mentions how we might also move towards overvaluing the potential and promises of mental health chatbots. In general, we also included a question about their general attitudes towards mental health AI chatbots. And in general, it wasn't like a completely optimistic, it was a moderately optimistic, a positive attitude towards the use of AI chatbots. Potential users were slightly more positive towards it than patients. And mental health professionals were less positive about the implementation of AI chatbots in therapy, but they were more in favor of it of being used in general as a mental health support tool. I'm going to skip through that. So if we want to think a bit about, okay, what are some of these, how do the results of these have an implication for mental health care today? I think to focus on the good, we know that mental health chatbots do provide this like exponential availability and accessibility to a variety of individuals and populations that otherwise would not be able to. So for example, a study in the UK already shows that a lot of groups that otherwise would not have access to mental health care through the introduction of chatbots, were able to have access and to benefit from the advantages of accessing mental health care through chatbots. One other concern, especially since it was a requirement and a concern for many participants, is privacy and security. Also important, especially when we're talking about wellness technologies, and many of these chatbots do not fall under a medical under the medical umbrella. And so it is important to also see how they are being deployed while taking into consideration privacy and security, and also some of the harmful implications that arise, expert oversight. Several scholars have also argued as to how chatbots should not replace human interactions in the pursuit of more inclusive mental health care. So even though they are providing accessibility, this should not be a replacement. Behavioral influence, going back to the case of Pierre that committed suicide. But also interestingly, and why I want to raise this is because recently a study showed that AI chatbots were able to reduce conspiracy beliefs by 20% through dialogues with AI over a period of months. And I mean, if this was only developed for trying to challenge conspiracy theories, we could also imagine how this might have an impact on individuals with mental health conditions. And we could even say individuals that are in vulnerable positions. And finally, over-dependency is there was also this very interesting study which also tried to see how users kind of perceived a chatbot, especially Replica, which is a very well-known chatbot. And they also see that those that are experiencing social isolation and loneliness tend to anthropomorphize these chatbots and consider them as friends and mentors. Okay, I'm not going to go over this, but we can discuss this probably later on or during the talk. But probably no, I'm going to skip this. I'm going to skip this. One thing I want to kind of link also to yesterday's, and I will end there, is about that we keep on talking about AI and the opportunities of AI, but kind of, following up with the idea that AI chatbots should not be a replacement to therapy, but more of a complementary addition, we should not be, by looking at how can we improve AI chatbots, we should not be thinking of the question, how can we incorporate this human feature that is normally seen in therapy into chatbots, but rather ask, where can AI chatbots kind of be implemented in the therapeutic process? And now how can it completely revolutionize the whole therapeutic process, but where exactly can we delegate certain aspects to a chatbot? And with that, I will end, and thank you for your time. Stay here. Okay. Stay there.